So, sizeism is another system of discrimination within our society where people who are in larger bodies have unequal access to resources and opportunities. And we do see that discrimination, as mentioned earlier, happens on both ends of the spectrum. But the tenure and the type of discrimination that people in higher weight bodies face is much different than people in lower weight bodies.
The body condition scoring system, I think, is, a much better tool than what is talked about from the BMI because of its validation. But I think it still has to be used properly because otherwise you are going to see faults with it.
Welcome to Diversity and Inclusion on Air podcast. This podcast is a program of the American Association of Veterinary Medical Colleges Diversity Matters Initiative. The podcast explores various issues related to diversity and inclusion in the veterinary profession, and provides the AAVMC an opportunity to offer ongoing diversity programming to our member institutions as well as all veterinary professionals. My name is Dr. Lisa Greenhill, and I am the Chief Diversity Officer here at the AAVMC. Happy New Year to everyone. We did not at AAVMC intend to take the last whole quarter of 2024 off, but schedules just did not allow us to really kind of create new content. But we're back now with an exciting slate of new shows and new branding. So we're really excited. Kicking us off for 2025, today we are discussing sizeism and weight discrimination in veterinary medicine. This topic has been on my to-do list for over 2 years. I am so excited that it's finally coming to fruition. So let's get into it, shall we? So according to the World Health Organization, about 43% of people globally are considered overweight and or obese, right? And if you're from the US with our supersize me portions, that percentage actually goes up to about 74%. Alternatively, because oftentimes we think of sizeism and weight discrimination as exclusively being about being overweight. But, folks that present as underweight, whether they actually are or not, also experience issues around discrimination, marginalization. Might look a little bit different in some aspects, but it's still an issue. So about 6% of folks globally are considered underweight. And in the US, that is about less than 2%. So weight discrimination is a thing. It's seen across all sectors, much like other forms of discrimination and marginalization. So we see it in employment, we see it in housing, we see it in education, healthcare. How many times have you been to the doctor for, I don't know, oh, my nose or earlobe hurts. Have you tried losing weight, right? That's kind of like one of those kind of things that we always hear about and experience, right? It also manifests in relationships, on social media, on and on and on and on and on. So the question for today is how and does that spill over into veterinary medicine, and what does that kind of look like? We know that about over half of dogs, 56%, I think, in some of that more recent data, 50% of pet dogs, 60% of pet cats are considered overweight or obese. No, not everyone has one of those giant Maine Coon cats. Some people's cats are just overweight. They're just big, right? But only about 45% of cat owners and 39% of dog owners actually consider or know that their pets are overweight. So sometimes they just don't know, right? That whole body condition score thing. Who knows, right? There's also some really interesting research that explores the relationship between the size of pet owners and pet parents and their pet's weight, right? So, it may be a situation where if you are carrying a few more pounds, your pet might also be at a greater likelihood to carry a few pounds. So to pick through this issue with me today, I'd like to welcome my two guests, Dr. Jackie Parr from the University of Georgia and Dr. Erin Harrop from the University of Denver. Welcome to the show.
Thank you so much.
Thank you. So, as is the custom on diversity and inclusion on air, I ask my guests to share a little bit about themselves and how they got to this wild and crazy point of talking about weight and pet ownership. I'm going to toss the mic over to Erin first to tell us a little bit about their background. Hi, Erin.
Oh, well, thank you so much. I am still wondering how I got here, but it's great to be here. My name, Dr. Greenhill said, is Dr. Erin Harrop, social worker. So my academic background is in social welfare, and I specifically focus on the area of weight stigma and how that impacts healthcare provider interactions with patients. So my specific area of research has to do with eating disorders. So I look at high weight eating disorders, specifically atypical anorexia, which is starvation in what we call a quote unquote normal or higher weight body. And necessarily that work intersects with weight stigma because so often starvation and malnutrition is missed in bodies that don't look in kind of thin or emaciated the way someone might expect them to look. And so I am coming here. I'm also what they call a critical obesity scholar, which means that I study the obesity medicine literature from more of a critical standpoint, looking at how social determinants of health and other kind of paradigmatic assumptions about causal connections between weight and health manifest in our current paradigm and what it means if we kind of step outside that paradigm and think about, what if it's not just an individual's responsibility? What if it has more to do with kind of greater social conditions and those types of things? So as far as pets, I have zero specialization in veterinary medicine, but I do have an adorable little pit bull named Willow who's 13 years old and has kind of been one of the lights in my life for many years and have owned pets pretty much as long as I can remember. So I'll speak a little bit about my experiences as someone in a larger body going to the vet and talking with vets about my pet's weight. And then I will do as much as I can to connect what we know on the human side about weight stigma and how that impacts our interactions socially and relationally to what might happen in the veterinary office.
Thank you so much. I am, I've been, since we met, I've been kind of looking at some of your work. I'm just so excited as someone also who has a history of eating disorder in a body that didn't look like.
Mhm.
So no one took me seriously until some really close friends kind of stepped in and said, we see behaviors, even though the body is not matching, right?
Mhm.
So yeah, and you also just never know, we all kind of show up with everything, right? But
Yeah.
so much of that is unseen, unspoken. And so, it's really hard sometimes for even people to kind of pick up on cues, right?
Mhm.
So can't wait to engage in this conversation. So Jackie, tell us a little bit about you and your background.
Yeah, I'd love to. And I have to say, first off, I love that I'm doing this with a social worker. My sister is my best friend, and she is a social worker as well. And so we have a tremendous number of conversations about just even how pet ownership interacts with socioeconomic status, but how much
Mhm.
pets do for people that are in that difficult situation. And so it's incredible the work that social workers do. And so I'm really excited that you're here, Erin, as well. So I am Dr. Jackie Parr. I'm an clinical assistant professor at the University of Georgia. I head up our clinical nutrition service here. We started our official clinical nutrition service in 2020. I trained for 14 years prior to finishing up my training in specializing in nutrition. And so I did the Bachelor of Science honors and started with my love of animals and nutrition there, moved on to veterinary school, moved to the US from Canada. I'm born and raised Canadian. And so moved to the US in Boston and did my emergency medicine and surgery internship, then stayed in Boston to do a master's at Tufts there and my residency in clinical nutrition. Once I was done all of that, I thought just a couple more years. So I went back to the Ontario Veterinary College and I did a postdoctoral fellowship where I was delighted to be part of the first clinical nutrition service in Canada. And I've been able to use some of those key learnings to build out our clinical nutrition service here at the University of Georgia. And so throughout all of that time, we could see very clearly during my mentor and I could see very clearly during my internship, during my residency, that the trajectory of over-conditioned pets was increasing. And so this became a passion area for me very early on. And a good colleague of mine, Dr. Jason Coe, who runs the relationship-centered veterinary medicine group at the Ontario Veterinary College, being a proud alum and being a nutritionist, we've been able to partner on a number of projects. And so I'm excited to share some of the work that I partnered on with him, some of the work that his group and his team has done in this space, because I think it's really important how we have the conversation. And that's part of my mission as a professor teaching the next generation of veterinary students is everybody comes to a conversation with some sort of baggage. We know our society has not been kind about weight conversations in the past. What can we do to make this a better interaction so that people can actually be successful? And I think one of the things that keeps me going is when you do the conversation right, to see a pet owner get so excited that their dog or cat is acting like a puppy again because you help them lose weight in the right way. It's just, that's a really incredible feeling that you've helped them to succeed there and that their health is improved. It's had this wonderful, unexpected benefit of some of the owners have then said, I actually started, my dog feels better. They want to go for walks. So now I'm getting out and walking and my doctor is seeing my health improving. And I told them I just needed to go see my veterinarian. That was what, that was what did it for me.
Sure.
It's just far-reaching implications to this area. So I'm excited to be here.
Awesome. Well, welcome to you both. So let's dig in. So Erin, we're going to start with you. What is sizeism and what is it rooted in? Besides that fake BMI thing. Yeah, I said it.
So sizeism is another system of discrimination within our society where people who are in larger bodies have unequal access to resources and opportunities. And I do say people in larger bodies, and we do see that discrimination, as mentioned earlier, happens on both ends of the spectrum. But the tenure and the type of discrimination that people in higher weight bodies face is much different than people in lower weight bodies. So, which isn't to say that people in lower weight bodies don't experience that. I'm sure we've heard, really flippant comments like so and so just needs to eat a cheeseburger or that kind of thing, which is absolutely harmful in and of itself. To judge anyone's body by its aesthetic and hold it up to ideal, and ideal is harmful. However, people in the largest bodies in society are disproportionately bearing that burden. And so when we're thinking about how it manifests, this manifests as in the human environment, doctors spending less time with patients who are in higher weight bodies, nurses being less likely to touch a patient who is in a higher weight body, a therapist reporting that their client is more likely to be non-compliant if they're in a higher weight body, or lazy, or to demonstrate less self-control. So making assertions or assumptions about someone's character based on how they appear. In terms of employment, we see it manifesting as people getting paid lower wages for the same job, being less likely to be hired, less likely to be promoted, less likely to get into grad schools, particularly within health science-based fields. Within the legal system, you're more likely to be convicted if you're a defendant in a higher weight body versus a lower weight body. If you're a victim of a crime, you're less likely to be believed. And so these impacts are far-reaching, and it's below the consciousness level of most people. And so most people, while they might express a preference for a thin partner or for themselves to be thinner, most of the time they don't understand how these kind of subliminal messages about body size are kind of shaping their beliefs about other people and internally their beliefs about themselves. And in terms of where this comes from, so over the years, if you look at kind of standards of beauty and the beauty aesthetic, those have waxed and waned, and they also wax and wane within different cultures as well. So we see kind of, geographically around the world that different body types and ideals are upheld at different times. But where we really started to see this really intense stigma with higher weight bodies actually goes back, and Dr. Sabrina Strings has published a book called Fearing the Black Body: The Racial Origins of Fat Phobia. So if you're a history nerd and really want to dig in, and particularly if you love art and art history, Dr. Strings does an amazing job of showing how the transatlantic slave trade partnered with things like Protestantism to really promote this idea that thinner bodies were better ideals within society, that they reflected more godliness, more purity, more self-control. So those puritanical, beliefs about self-control and godliness were really recreated through this kind of fusing of size with morality. And similarly, if we look at the history of the BMI, and there's another fantastic article called The Racist Origins of the BMI that traces this as well. It was also fused with race. So BMI was developed by an 18th century astronomer who was obsessed with normal distribution. So he loved, the bell curves that we see. And his idea of the ideal man was the one who was completely average. So average height, not too tall, not too short, average weight, not too fat, not too thin. And he was really invested in discovering what could be this ideal as measured by the bell curve. And his work was later taken on by eugenicists who were interested in the ideal man as far as which ethnic groups of people were best suited to which types of labor around the world. So you can see again how this is reinforcing racial stereotypes in the slave trade. And then later, when we saw it adapted to humans, was with the starvation studies by Dr. Ansel Keys. And also when it was applied as the first time it was used as an individual marker of health was by life insurance companies, where capitalism got to step in and take hold of this. So in short, BMI is a very rough measure to describe distributions of people, or how large or short or tall or big populations are. And it correlates very poorly with actual metabolic health and very poorly with mortality. And so being able to have kind of a critical view of how some of these beliefs have really become ingrained, not just in our societal conscious, but specifically within our medical consciousness and how we think about health is really kind of a fundamental linchpin of weight stigma.
All of that. Yeah. Those two books are really phenomenal. I highly recommend them. You'll be angry. And as I often say, guess what's at the root of it? White supremacy. Like it always kind of comes back to some of these things, right? That BMI thing has haunted me my entire life. And I constantly, I'm always pushing back even on my own health professionals, where I'm just kind of like, why are we talking about that? That don't even apply to me. But like this body type, just, we don't have anything to do with that. Like, something like, let's talk about some other things, right?
Well, and I think
Yeah, go ahead, Jackie.
I think it came to a head this summer when one of the Olympians was being called, which she was being, there was name calling, and she just divulged her BMI and she talked about it openly and said, this is my muscle, right? Like I am incredibly muscular, but it was really nice to talk about. There is no one Olympic body, right? Like there is a huge variety, and different body types are, maybe more suited for different activities. And that's what there was an opportunity for everyone to excel in their particular field and with their particular passion and what they found worked best for them. But I thought that was a very brave conversation to have around the Olympics. And I hope those types of conversations continue, because they do need to be had, right? This name calling that's still happening, nowadays, because you can be anonymous. It's kind of crazy that someone would name call over a BMI for an Olympian, right?
Like an Olympian. all
Imagine
of the
with your
people that are couch
average,
surfing at home watching the Olympics like, for 12 hours a
imagine with
day
your
and talking about the
average,
BMI of this athlete.
person, yeah,
Right?
experiences, if that's happening to an Olympian, right?
Yeah.
Like,
Mhm.
it just it puts it into perspective, and it was nice to see someone be so brave and
Yeah.
really stand up for themselves. Yeah.
Absolutely. I mean, we see it, see it actually through sports a lot, and particularly women's sports, right? So
Mhm.
Serena
Mhm.
Williams, and oh my goodness, like she's built so differently. And why does she have to wear a cat suit? And we see too
Mhm.
much of her body, and we do
Mhm.
this and we do that. Misty Copeland, right? She doesn't have a ballerina's body. Right.
Mhm.
Okay. So what's that supposed to look like?
Mhm.
But we're always having these critiques. Like I said, I'm always intrigued because at least in the US, I'm like, okay, but it's like 75% of us.
Mhm.
What are we
Mhm.
talking about?
Mhm.
Right? And so, it's these things are really interesting, to the point that you were saying, Erin, how it's kind of like on the surface, but there's just a lack of consciousness about it, right? We just accept it, and we accept a lot of these metrics as legitimate because even though their source material was like bananas,
Mhm.
somehow 100 years, 200 years later, it's considered legitimate now.
Mhm.
And then we're still held to these bizarro standards. So Jackie, we talked a little bit about BMI. So in vet med, of course, we use the language of body condition, right? But what does that mean? And also, yeah, how do we conceptualize that, right? In terms of the positive, negative, and to Erin's point, the morality. Like, are you just not walking, you
Right.
know,
Right. Yeah.
Fido enough? Or you're giving too many treats to those very
Yeah.
highly treat motivated
All
critters.
of those ideas that may lead people to feel very guilty, right? When we haven't considered all of the other things that are part of this package, right?
Yeah.
And
Yeah.
so I am very glad that we have the body condition scoring chart, because it's quite different from the body mass index in that I think we probably have a better tool in veterinary medicine than we do for any human being out there. And
You mean it's rooted in science? No.
it is. It's been validated using DEXA scans, so dual
Mhm.
X-ray, dual energy X-ray absorptiometry. And it's really nice that it looks at both dogs and cats, and gives some ranges of percent body fat, but it's not entirely focused on body fat. It's also focused on the lean body mass and muscling. And so those sorts of things that we need to take into consideration. And in the last decade, a separate muscle condition scoring chart has come out because of the implications of muscle loss on dogs and cats as
Mhm.
they age, and how that can affect their quality of life, right? And being able to get to their favorite sleeping spaces and go for that sniffy walk to, sniff the pea mail around the
Uh-huh.
neighborhood. And so all of these things, come together to play a really big role. And so the body condition scoring system, I think, is, a much better tool than what is talked about from the BMI, and because of its validation, but I think it still has to be used properly, because otherwise you are going to see faults with it. And so one of the things that was quite popular a while ago was that someone had creatively turned the body condition scoring charts into chonk charts. So they used the word chonk, CHONK, right?
Oh.
Chonky, and they called it a chunk chart. And it was the cat chart that started first, but it would like sort of progress from, oh, he's a big boy, all the way to like, oh Lord, he coming, right? Like, and it was just like, it was this extreme of like, oh my goodness, like someone's using this as humor, but what message is that sending? And so I actually use that example in my classes as I'm teaching to say, we would not joke about kidney disease, right? Like, I'm not going to walk into a room as a veterinarian and, someone, said, oh, what a chunky pop. Oh, what a chunky monkey. Like, oh, they got to get their summer bod, right? Like you'll hear people trying to like, diffuse the situation. And we can get into why some of the
Yeah.
literature showed they're trying to diffuse using humor. But we would never walk into a room and say, oh, the kidneys, they're just these little shriveled up raisins, right? They can't do anything. Like you would, the joke is with, inflammatory bowel disease. I was like, you're never going to walk into a room and just say, oh, she's got the poopy squirties. Don't worry about it, right? Like,
Mhm.
don't worry. Like, it's so different how we have this conversation. And I think part of it stems over from all of these societal implications that have come over from the human side. And so I think veterinarians go in, their brains are just running a mile a minute. They're about to have this conversation and they want to help. They truly want to help. And so they'll use humor to try to diffuse the situation up front so that someone doesn't get mad at them for telling, and that may very well backfire, right? That may,
It does. But
Mhm.
wait, so
yeah.
what you're saying is that folks in the profession memified the body condition score chart.
And I don't know who did it because it was just posted on Reddit, but it became very popular.
Thing.
There were memes everywhere, right? Like you would see, cats and it would say chunky and loving it, right?
Yeah,
Like it was just,
yeah, yeah,
it became, the chunk chart
yeah.
became
Happy
very
fat
well,
cat.
felt very well, exactly, became very well known. And I really worried because we wouldn't do that with other conditions, but I think that this occurred because that's been done, veterinary professionals are using humor. And when asked about this in different, different surveys in different groups of veterinarians to try to ascertain and get to the bottom of it, it is about trying to they're trying to have the conversation in a kinder way. But I think they're also worried about if they just come at the conversation, that it may be perceived very negatively because they don't know what negative experiences that particular pet parent has had at their end. And so as a result, I think we probably have swung too far the other way in vet medicine. We actually have a great tool that we could go into the room with, and I could tell you how I use it and how I've used it successfully to have a collaborative conversation with a pet parent. But I think unfortunately at times it's swung too far the other way, and there's this humor piece that is really clouding the situation.
To Erin, previous points, like it also speaks to our it's okay to joke around about larger bodies. It
Mhm.
like joking around about larger bodies is the easy way of diffusing
Mhm.
this, right? Like, and so then the larger body is the butt of the joke that's
Yes.
supposed to make it easier. And
Yeah.
Mhm.
right. And
Mhm.
so, as Jackie mentioned earlier, that, maybe this doesn't work so much. And my previous dog, I took, my previous dog to the vet, and she said, oh, Buddha is chonky. And I was like, chonky, clutch the pearl. Like, what are
Mhm.
you talking about? This is my sweet baby. And it was like she thought maybe I didn't know what chunky meant.
Mhm.
And it was like, thick, fat, big bone. And I was like, I mean, we did not have to use more derogatory words about
Mhm.
my sweet angel in this moment. I knew what you meant, but like this is the last place I expected this conversation to start this way. Erin, is this I'm assuming that I guess, hopefully physicians are also not like chunky, but
Hopefully not.
BMI chart has not also been memified to be chunky. And don't y'all get any wild and crazy ideas over there in human medicine.
And I think what one of the things we're hitting on, and where, I as a layperson might come in, is that oftentimes we have this conflation of body size and health. And I don't know exactly how it works for dogs and for cats, and so I have to kind of own that absolutely. But within humans, we know that kind of this ratio between height and weight is pretty unreliable as far as kind of like being able to eyeball. And I apologize if I don't know the body condition chart very well. I'm used to seeing on the vet wall kind of the drooping bellies in kind of,
Yeah.
ascending order.
Yeah.
And which also kind of like there's this stigma that we're seeing mirrored with humans and pets here, right? So
Mhm.
like drooping bellies on humans, like carry a huge amount of stigma for people. And so when we use that, body condition score, I can see how somebody in a body like mine or in a body someone like larger than mine could see this analogy kind of stigmatizing the belly or stigmatizing some of these things. But I think one of the things where people may get a little bit defensive is when that kind of eyeball approximation of how healthy someone appears, either by a number or by kind of the sagging of the belly, is kind of conflated automatically with the health, whether it's of a person or an animal. And so we know within BMI, in humans, so there was a fantastic article that came out in 2016 that looked at the NHANES data. So kind of
Yeah.
our largest registry of nutrition data that we have, and found that when we use BMI as a proxy for metabolic health, so our cholesterol, our insulin regulation, our blood pressure, that we're wrong for overweight folks roughly 50% of the time. So
Wow.
about 50% of people who are in an overweight BMI category are actually metabolically healthy. And about 29% of people in the obese category are metabolically healthy. And 16% of those with type 2 and 3 type obesity, so the higher types of obesity, are metabolically healthy. And on the flip side, about 30% of people in the ideal BMI are metabolically unhealthy. And so when we think about that kind of proximal measure of like eyeballing someone, whether it be by a number or by a silhouette chart, is wrong, roughly 1 out of 2 to 1 out of 6 times. And so I think when we think about that in veterinary medicine, there's a healthy amount of skepticism around eyeballing someone's weight or
Yeah.
eyeballing someone's health. And so what could be happening is people could be saying, okay, like I understand that my body or my pet's body might look this way, but what actually, critical obesity scholarship, we ask people to say, like, what's the actual mechanism, right?
Yeah.
What is the adipose tissue doing that's causing dysfunction? Because that, I am concerned about my cholesterol. I am concerned about my insulin. I am concerned about my blood pressure. But the degree to which my belly protrudes is a little bit more, I mean, that impacts me stigma wise. But that as somebody, pretty invested in body image, I'm going to try and downplay that part and focus on what is that more objective measure of health. So in having some of these conversations, one
Yeah.
thing that I wonder about is like if we could bring it around to a lab value or a
Yeah.
functioning or those types of things,
Mhm.
could that open a door where it's like less like I'm eyeballing you and your pet's body looks a little unacceptable? Could we
Right.
shift it so it's saying like we are noticing this impact on your pet's, health panel when we're looking at their labs, or we're noticing this value going up or this value going down, or we're noticing decreased range of motion, or we're noticing
Yeah.
this part of arthritis. So I think that conflation sometimes between appearance and health could be a place where patients and pet owners get a little defensive of
Yeah.
their pet.
And given that, I mean, what was it like 45% of cat owners when like 60% of cats are 60% of cats are overweight and 45% of cat owners are like, what are you talking about? My cat is fluffy. It's not fat. Like, and 39% of dog owners, I would fall into that category where I'm just like, I didn't think that my dog, when we went a few weeks ago was overweight. And yet it was like, we'd like to see him lose a couple of pounds. And I'm like, he walks 2 miles a day and
Mhm.
we play and like so Jackie, to Erin's point about like, how do we talk about this in a meaningful way? Like, we see the chart. I prefer the chart, not the droopy belly one, but the aerial view that is like, oh, maybe Barkley should have like an hourglass.
Yeah.
Like, kind of
Yeah.
makes a little
Yeah,
bit more sense to me.
absolutely. Yeah, absolutely. Well, and there are some ways I've found music successfully, but it can't be a drive-by conversation. You
Yeah.
have to be able to teach the owner, and it always relies on a hands-on physical exam. And the best way is to get them involved in the physical exam because you want them to understand it. And so what I'm teaching the students and what I've found to be most successful when having conversations using the body condition scoring chart is that the owner's doing it side by side with you. So as you're doing the physical exam on a dog or a cat, you're also having the owner palpate the ribs. And we actually have to standardize this. We actually have some models that the owners can feel at the same time to sort of get a sense of the level of pressure they should be applying and then what they're feeling for there. And then what we go to next is, and typically, this animal may be happy-go-lucky. They're bopping around the exam room. So sometimes what we'll do is have, mom, dad, whomever is bringing the pet that day, hold their head, comfort them. And then what we want to do is get photos of them straight. And so we basically line them up on a grid. And if they are really floofy, like a Pomeranian, you cannot tell what body condition is until you put their hands on and you follow their body wall. Because you won't ever see a taper on a really floofy animal. You could have a long-haired cat. So you have to put hands on the animal. And what we try to do is, with the owner's permission, take a photo so that then the animal can go bop around the exam room and be happy and interact, but we can show the owner what we've taken a photo of and they're involved in it, they're seeing it in real time. Then the last one we take is that side view, and it's very different in dogs and cats because they do have a different distribution of how they carry their body, Pat. And so cats will tend to carry it in an abdominal pouch, and so a cat could have a very loose pouch because they previously had more fat in it. Or it could be that it's a pouch that's just how they were born and it's just more loose. So you absolutely have to feel the kitty pouch because you can be very mistaken and it could be practically empty. And so what I teach students is nutritionists love fruit, and it should be no bigger in diameter than a little cutie orange, that little fat pad. I want to feel those abdominal muscles. And then if it's starting to expand, we're getting a peach, in Georgia, those sorts of things. And we're taking that into consideration. And we'll teach that to the owners as well. And then dogs tend to carry their fat intra within the abdomen. And so that's where you will see that extension from the ribs out. And so we'll take all those photos, and then what I will do is I'll actually hang out with the owner and then we will decide upon the number. So first I'll ask them to take a moment to read the criteria on the chart, and I'll let them know how it's been validated with DEXA scans and that we've looked at this in multiple breeds and multiple species. And then I'll have them tell me what they're seeing because I do want to understand, and I want to have them to have that chance to be able to speak up and be part of this conversation. And so, I'll ask them what they're thinking. And then if there is, sometimes we won't be on the same page. And then I'll explain, this was the criteria here that put me in this category. I'm only using numbers. I'm only using 1 through 9 for the numbers. We're not using any terms that are funny. We're not using the word fat. We're not using the word obese. I'm not using the word overweight. We're just talking about a number. And so the thing that's been found in the research is if we do have pets, and I like to use the term over conditioned when there are 6, 7, 8, or 9, which would be the high end of the spectrum. I like to use over conditioned, just like with the under conditioned pets, I use the term under conditioned. I'm not using malnutrition or starvation, things that would have a really negative stereotype with them. I don't want to use any wording that could potentially shut a pet parent down so that we can't have this valuable conversation. And then the challenge would be, and I'm so glad you talked about the BMI in humans, the challenge would be in dogs and cats, we have really good evidence that the higher the body condition, the shorter the amount of time you get with them. And so we don't have to focus on all of these other things. There was 2 studies done by Dr. Jason Coe and Dr. Kat Sutherland, and by far and away, the thing that changed a pet owner's mind about having them work with a veterinarian to lose weight was, you mean to say, because my pet's just a 6, just a few pounds overweight, there's a possibility I'm going to get years less with them. And so there was a lifetime study done in Labrador retrievers, and that's the difference between animals and human beings. We're not going to get that lifetime data in human beings. And animals, this was a lifetime study in Labrador retrievers. They were pair matched. They had identical genetics, identical, environment, identical veterinary care, identical food, right? You name it. And one was slightly, overweight, a 6 or 7 out of 9, and one was kept at a 4 or 5. So the only difference was one got 25% more calories than the other, and they lived together their whole lives. And on average, the dogs that were 6s and 7s died 2 years earlier.
Oh.
And so that hits really hard. If you have a dog that like 13 versus 11 is huge in dog years. And so that's where I see the conversation being a little bit different there. Our lives are so long. It's going to be it would be very challenging, even with, recalls in the NHANES data with, dietary recalls in people and, recall bias and all the things that it's really, really challenging. Even in some of the primate studies that have been done to try to approximate humans, there's not clear-cut evidence, at least from what I can recall. And so in dogs and cats, I realize that we're very fortunate that we have that piece of information. And then it's also been correlated with a loss of muscle mass 2 years earlier, which impacts quality of life.
Oh, yeah.
And for every, it is always about quality of life. It's really not about much else. It's about how can their life is too short for me already. How can their life be better? And how can they live as long as possible? And so that's where things are a little bit different for us. But if we don't have that conversation in the right way and use that relationship-centered approach and make sure that we're not placing any sort of blame, the conversation is not going to go well, and I'm not going to be able to help them with their goal. A lot of people who come to a nutritionist say, I want you to make my dog live forever. And then I'll say, here are the few pieces of evidence that I have that we can have a longer life in animals. And I will do everything I can with you to support you with this, given this is your goal. But we need to understand what their goals are from the get-go. And then that goes into the whole spectrum of care of what's actually reasonable, right? Yeah.
Wow.
It's very different. I've enjoyed so much learning about it from the human perspective, because it just helps you to understand that when there's been a conversation had on the human side of things, there's not as much evidence backing that up. And so for anyone who's coming to me with a medical background that's aware of that, well, it's just like the BMI, right? Like it's just look at this information, right? And so there are absolutely markers that we can use, like the DEXA is, this beautiful tool where we scan and we love it, but we have to sedate animals. So, in cats, things like a fructosamine, sort of like a hemoglobin A1C, right? To look at long-term blood glucose regulation. We get dogs that if there's not an endocrinopathy and they have elevated cholesterol and they were fasted for their blood work, that we've seen with gradual weight loss that cholesterol does start to decrease over time. And if a pet parent has had concerns about their own cholesterol, then that's a meaningful, more objective, piece of criteria for them. And so we absolutely try to take it back to these, much more objective pieces each time. But I find if I'm working alongside the client, if I'm using terminology that is going to be, as well received as it could possibly be, and we're partnering, then that ends up being a much more fruitful conversation. And we've had clients thank us for having the conversation in that way, because no one ever took the time to have it, because most professionals are really strapped for time, right? It takes time to do this conversation well. And I'm lucky that I have that time as a nutritionist. So
Yeah. And I mean, I think in human health, we get that drive-by that
The
is like,
drive,
the
right?
drive-by that is like, oh, again, you're here for your ear.
Yeah.
Mhm.
Wow, let's take a look at that. So, have you thought about losing weight?
And if you do the drive-by in veterinary medicine, I think it has the same effect, right? Like,
Yeah.
Mhm.
look over there. Oh, yeah, you're this, right? You haven't
Mhm.
taken the time to put hands on, to feel, to match up the
Mhm. Yeah.
criteria, to actually explain what you're doing.
Mhm.
Because people are so strapped for time and there's a veterinary shortage, I worry about that happening, in the future. And so, one of the studies that was again done by Dr. Kat Sutherland looked at, nutrition conversations during general practitioner appointments,
Mhm.
and the mean was under a minute to discuss
Mhm.
nutrition, right? And
Yeah.
so, nutrition as a whole, and pet parents are very concerned about their own nutrition. They're very concerned about their pets' nutrition. There's a lot of misinformation online. There's a lot of emotion tied to food. And so that's where, I really do believe that we need more nutritionists in the world that can have these conversations with
Yeah.
pet parents so that they can realize, yeah, you're doing a good job with the tools you have, right? And, I'm really sorry that people are, online, just, writing awful comments because you said you fed your dog kibble. You are not a bad person.
Mhm.
You are doing a
Mhm.
great job, right? Like, when a client comes to me in tears because they're feeding kibble, and they like, how awful is that, right? Like,
Mhm.
it's very interesting how some of the human nutrition fads that make part of this
Yeah.
conversation and
Oh, yeah.
this whole
Brain
concept
free.
pass into the pet perspective, and it
Mhm.
becomes a really difficult conversation. I have clients who are paying to cook for their dogs. They're spending like $10, $11 a day. They
Oh,
are
yeah.
paying to make a homemade diet, and they are eating Doritos because that's all they can afford at the end of the day. And I'm like, no, that's not the
Mhm.
goal, right? The goal is
Mhm.
that let's pick something that's a little bit more reasonable for your budget, that's going to be really
Mhm.
good for your pet. You don't have to do all this.
Yeah.
I had a client in a wheelchair who was trying to home cook because she was told it was going to prevent cancer. And I was
Mm.
like,
Mhm.
unfortunately, we can't have food say, yeah, we don't have that evidence. And so, can I do
Mhm.
something for you that's going to, work a little bit
Make
more
life
with the
easier.
situation you're in right now and make things a little bit easier for you, and then we can revisit in the future, but let's support both of you. And so,
Yeah.
yeah,
Yeah.
it's really tough to hear what some people are going through when it comes to diet and weight
Yeah.
conversations.
I was just going to say something that I so appreciated in preparing for today was looking at the nutritional assessment that you sent
Yeah.
over that you use with patients because it was so holistic, right?
Yes.
And it looked at, so often when we're having these drive-by conversations, either in
Mhm.
human medicine or in veterinary medicine, it's this very, first of all, oftentimes if you're in a larger body, there's this assumption that one, you don't walk your pet or you don't walk
Right.
your pet very far, right? That your pet is not getting exercise because you could not possibly have exercise, right? Which is
Yes. Yeah.
a demoralizing
That morally.
experience if because that's a direct manifestation of the stigma that you face in society, and or that you're feeding your pet you know crap, or that type of thing, or that you're overly indulgent, that it's fitting in with these kind of weight stigma assumptions that we have about people in larger bodies. And the assessment that you had was so individualized in terms of like looking at how is your dog moving, what kind of activity are they getting, are they and that emphasis on quality of life, like what activities are they having trouble with, and then looking at the food, how often, what kind of food. I know for, just on a personal anecdote side, I had when I was young, kind of, early 20s, with my first independent cat of my own that
Yep.
I'm trying to care for with no pet insurance, and,
Yes.
very,
Yep.
working three minimum wage jobs type situation, trying to take care of this kitty who ended up with, kidney issues from the crystals, right? The buildup. And, I learned that very cheap food that I had been buying for my cat had a very high percentage of ash and other things, which were contributing to this urinary buildup for my kitty, which was life threatening for him, and being able to have a conversation with, when I spoke with a vet, Like basically they recommended a food that was so cost prohibitive that I left feeling hopeless, right? Like I left feeling like, I can treat this acute problem in the moment, but I don't know how to keep this from happening. And luckily I had a friend who was able to like do some research into the quality of food and find like a middle of the road, kind of what you're
Yeah.
talking about, right? Like maybe we don't have the chef cook for our dog, but we find something that allows us to eat and our pet to eat too,
Yeah.
but that, had way better balance of what nutrition my cat actually needed, and then, that was able to kind of control the kidney symptoms that my cat had been having as a result of that, the type of food that they'd been having before. So I think having these kind of more holistic discussions where we're taking into account, the whole of the person's socioeconomic status, the
Yeah.
whole of what they can do for their animal, and then maximizing that quality of life like you're talking about is so important. And we only, in human medicine we see this as like fat people don't even get asked the question. I've worked people where they'll be like, why don't you start, walking 3 times a week for 20 minutes? And it's like, oh, do you want me to cut back on my exercise
Yeah.
right now?
Right.
Because
Or do
right
you want
now,
me to walk in an unsafe area because I work till 9 p.m. and there's no
Mhm,
lighting in the neighborhood, right? Like would you like based on where I am able to live right
Yeah.
now,
mhm,
is it safe for me to walk at
mhm.
night? I mean, I have a little Boston Terrier that I adopted. She would just lick whoever came up to me and give them kisses.
My dog too.
it's like you have to take into consideration people's safety. I have
Mhm,
rheumatoid arthritis, and when I'm having a terrible flare up and I'm needing to
Yeah.
go on steroids,
mhm,
I cannot be as active as I would like to be. And so,
mhm,
my dog, I'm taking her to doggy daycare because I know she needs that outlet, but I'm lucky enough that I'm in a position that I could drive her there and take her when my autoimmune conditions are flaring.
mm,
Right.
Not
mhm,
everybody with my autoimmune conditions has that financial resource or even a vehicle or some
mhm,
places that they feel comfortable taking their pet. And so
Yeah.
I always tell pet parents that, exercise is great. It's great for all of us, but sometimes based on our circumstances,
mhm,
you can't do
Yeah.
more.
Yeah.
Sometimes it's, a mobility issue. Sometimes it's a pain issue. Sometimes it's a safety
mhm.
issue. Sometimes it's the middle of winter. And like literally, like who wants to walk when I was in Canada when it was minus 20? Like I was like, Celsius. Forget about it, right? And so, we can start making small changes
Mhm,
that help them. And the quality of life piece, clients are so receptive to having that conversation. And I'm
mhm,
wondering from the human perspective, how often do conversations, with just say a general practitioner, a PCP, say, you know, what's your quality of life like day to day? And
mhm,
what do you think could improve your quality of life, right?
mhm,
Tell me about some of the things that could improve your quality of life day to day. And is that an area that's happening right now to help some of these conversations? Because I feel like that could maybe open the door to a more
mhm.
positive conversation if it was
Yeah.
around how's someone doing day to day.
Mhm.
Yeah. Yeah. Go ahead, Erin. Were you gonna say
I
something?
was gonna say, so I'm an affiliate member. I can't be a
Yeah.
full member because I'm not an MD, but there's an association called the Association for Size and Weight Inclusive Medicine.
Mm,
And they have a partnership organization called MISSI, Medical Students for Size Inclusivity, that really focus on centering health and quality of life of people kind of across the BMI spectrum before defaulting to just changes in body size. And one of
yeah.
the suggestions that the president of they call awesome, uh, that's what the AWSIM
Yeah.
spells out. I
Love
love
it.
our acronyms in medicine, but one of the things that she opens her initial client consultations with for primary care is, if we were to set kind of looks or body weight aside and just think about your day-to-day experience in life, what is one thing that you think could most improve your experience, your quality of life? And sometimes focusing on that one thing could result in a weight shift, and other times it doesn't, but we see the quality of life
Oh, love and
increase.
fruit.
So maybe that's, I want to be able to get up and down from the floor better so that I can play with my grandkids. Maybe
Yes.
it's, I, you know, want to change this thing about my bowel habits, or, whatever
Whatever it
is,
is.
is
Yeah.
going,
Yeah.
whatever is
It's
going
okay.
on
We
for a
talk about
person.
poop all the time in vet medicine. So it's
Yeah.
very
Surprisingly.
So, but yeah, I think that emphasis on quality of life is one of those really critical points of inclusive medicine, and a way to
Yeah.
get people on board with having some of these more difficult conversations.
Yeah. Wow. So we are almost out of time, but I do want to leave folks with a few takeaways. And also, so here comes Lisa's soapbox moment. So beware. But one, I think that it's important for veterinarians to know that these perceptions around weight is rooted in racism and white supremacy, and that does spill over because BMI in human health is held up as that thing, right? And I think that folks need to understand that a lot of marginalized communities, historically marginalized community, summarily reject that foolishness out of hand. Like, we only want to talk about it. And we may also make the assumption that the BMI thing feeds into the body condition thing, right? And if that's not true, y'all need to talk about that more.
no,
Otherwise,
that's a
we're
key
summarily
takeaway.
rejecting you too.
Yeah. Yeah.
Right? Which becomes yet another access issue for these populations, not only just in human health, but also in veterinary medicine, right? There's an access piece where we're going to just chop that conversation right off because we associate those two, right? And we already know how we get treated over here. So there's that. And then these issues, within the profession, like, I know that, like, productivity, and you got to turn them out, and you got to keep the patients going, but we also have to create space and time to explain some of this stuff, because a lot of times, even for those of us who are frequent users of veterinary service, love y'all, not perfect, love y'all though, but, like, my dog, little Yorkie mix, he's 10, like, we're getting over the hill, right? But he's had GI issues, reflux, for years. Have I had a veterinarian ever offer solutions? No. Why? His body condition was fine. I'm like, he barfs every day. Like, what are we doing? And so I'm now one of those people where I give kibble, but I also cook. And that was the only thing that really reduced it. Like, I had to find a balance. And, because I didn't feel like I was getting the help I needed from the profession. So, hello, another soapbox issue. But recognize that these things are connected, right? That these things are connected, that there are lots of folks that, even those folks who are utilizing services, are just not necessarily having their needs met because these explanations, this time is not provided, right? I work in the profession, and so I know my dog's belly is a little bigger than probably what it should be. I also know that he's motivated so much that his little manipulative furry self thinks that if we go outside again, that means he gets another treat. So after I get home, he will ask to go outside 10 times. And I have to be like, no more treats for you after the first time, right? Because they're not stupid either, right? Like these are all relationships, I think, is the point. And we don't really kind of think about what those relationships mean in terms of what that health outcome might actually be, despite the fact that there's tons and tons of research about these relationships and the importance of them. So that's my soapbox on what I think that people should know. Now I will turn it over to Erin for probably more reasonable, less argumentative takeaways.
I was thinking the one thing that I didn't mention so far that I wanted to make sure to mention is that, so I'm also, in my clinical work, I'm a therapist. I work with people with eating disorders. And prior to you even inviting me to this weird podcast, I had heard at least 3 times eating disorder patients talk about conversations that they had with a vet that re-triggered and reignited thoughts of their eating disorder because of the focus on weight loss and weight management, and how food and bodies were moralized in that encounter. And so I have so enjoyed hearing from Dr. Parr today on the differences between kind of human and animal medicine in this regard, and the patients that you see and the pet parents that you see likely are coming in with their own body stories, their own body image issues. People, the assumptions that are made about fat parents, and how much they walk their pets or how they feed their pets or how indulgent they are to their pets, and the assumptions in general, right, that like this cat or this dog is fat so therefore needs to eat less. Like those messages, they carry weight with the parents, and so for people with body image struggles who are in larger bodies themselves, and even many of my clients with eating disorders are thin-bodied people, but they've recently gone through changes because of recovery and because of refeeding, where they're learning how to approach food from a more neutral and nourishing way. I think this is part of where we do get nervous, maybe as providers, to have those conversations. So just thinking about, everybody's coming in with their own body story. And so the importance of taking time, and to take time to not moralize the body of the pet or the pet owner, to not moralize the food of the pet or the pet owner, and to not moralize the activity, right? And to take into effect or account all of those context factors that we talk about. Like that's something that I'm hoping we end with or leave with. Because all that moralization is going to feed right back into that stigma. And then that avoidance, whether it's avoidance of veterinary care or avoidance of people's own medical care as well.
Yeah. Yeah. I'm guessing that like the more that veterinarians moralize things, the more that all of us are stopping to get pup cups and a giant frappuccino for the visit. We deserve this.
Oh yeah. It's so funny. They'll be like, well, these, I fed these things, they were bad foods. I was like, there are no good and bad foods. There are no good and bad foods. Like
except grapes for your dog, right?
Yes, it applies.
Grapes are bad.
Grapes are bad. Grapes
for
are
dogs.
Right. Unless
for dogs, not for people. My eating disorder patients, grapes are fine. Grapes are fine.
Yeah. Yeah. Unless they're known to be toxic, right?
Yes.
Yeah. But I think taking away that piece of like, oh, this is good or this is clean, I think that's a really wonderful takeaway, because it also leads to judgments at a socioeconomic status level, right? Like there's, oh, you can't afford that, right? And so I think the way that we speak about food, it is to provide nourishment, and there needs to be a quality of life to it, right? At the end of the day, I think what we're doing is, as veterinarians, the goal is for that pet to have the best quality of life possible with that family, whomever loves that pet and interacts with that pet. And that's ultimately the goal. And I think that when having these conversations, the drive-by, as we've said, never goes well. So use the body condition scoring chart, explain that it is different than the BMI. That's going to be a very key takeaway, and involve the client in the process. And then to buy that space and time, I'm a big proponent of veterinary telehealth, because it creates better access to care. There's less need for transportation, there's less stress. And so in Georgia, once you've established that veterinary client patient relationship, you've done the exam, can this conversation happen with the whole family at once, and everybody's coming on different Zoom screens like we are, and we talk about quality of life, and we hear what everybody thinks is most impacting the pet's quality of life day to day, and then we agree to work on that as a group, and once we've tackled that, then we can come back and we can work on something else as a group. And so I think thinking about these conversations where we'd all like more time as veterinary professionals, I think, using telehealth to your advantage, clients love it. They absolutely love being able to have this conversation from the comfort of wherever they are. Sometimes the general practitioners will come on with us because they would like to have part of the conversation, and we love that if they have time. And so I'm hoping that's going to increase some access to care over time. And I think the last thing is I will often hear from veterinarians because of the time when they were trained, they did not get a lot of exposure to veterinary nutrition and they don't necessarily feel confident in it. And so then the conversation may not go as planned because there's a bit of like a lack of confidence of where to guide the client next, right? And so there is a ton of great continuing education out there, and I can share some links with the AAVMC. There's a couple of great organizations, really wonderful, continuing education. Some of it you can do in your pajamas from home over Wi-Fi, right? Like you don't have to, do this big expensive conference to help, start feeling more confident there. But if that's an area where you're a veterinarian and maybe you don't feel as confident, also work with your veterinary technicians because we are a team. And I have found over time there tends to be a veterinary technician in the practice that likes nutrition and likes nutrition conversations. And is that an opportunity for them to grow their skill set and be that person who's that support and helps the clients out? And so not resting this entire, conversation on the shoulders of just the veterinarian. There are wonderful technicians, veterinary assistants that can be involved in having supportive conversations and providing helpful resources to clients.
Fantastic. Thank you. Thank you both so much. This has been a really rich conversation, a really informative one as well. So now I have all kinds of nutrition questions for Jackie on what I cook my overly spoiled, slightly over conditioned dog. Um, without judgment, without judgment, right? But anyway, well, thank you both so much for taking some time out of your busy schedules to talk about sizeism and weight and all of these interesting things in vet med. Special thanks to Erin for agreeing to be on this wild and crazy conversation. When we first chatted a few months ago, it was like, well, that's interesting. So thank you for rocking with us all the way through today, and hopefully we can kind of keep this conversation going out in the hinterlands. So this has been another episode of AAVMC's Diversity and Inclusion on Air podcast. Be sure to like, subscribe, and follow us on your favorite podcast app, and we will be back soon with another episode of the show. Thanks so much.